right, guys, we're going to give everybody a few minutes and we'll start. All right, can you guys all hear me? Yes, no?
Yes.
Okay, if you guys are here, make sure you guys turn on your video so I can give you attendance. Just a few announcements moving towards next week. I know Monday is Columbus Day. I know you guys technically have school that day. I'm going to be out of town. So what we're going to do is we're going to do a recorded lecture. Okay, so you guys don't have to come to class. It's going to be short. We'll obviously review the lecture again in class, but I will have a very short assignment that you guys will have due that day on Monday as your attendance, because technically we still have to be in class even if we're not meeting or doing a live lecture. I will give you guys a bunch of updates on all of that, okay? Just so you guys don't forget. Your labs, your lab 15 is due on Saturday, right? No, Sunday. Sunday the 11th. Yes, just kidding. It's due Sunday the 11th. I know it's a long weekend. I know it's a weekend just in general. So if you guys still have to work on that, make sure you are doing that now during the week so you don't get stuck onto the weekend and not being happy about it. Okay, so remember we have our BMI lab done. We did the skin fold lab. Make sure you guys answer those questions and hand those in. Also make sure that I did put in Blackboard the data that you will need for your class for the BMI portion of the lab. Okay, so that data is under Blackboard under lab 14. So make sure you, not 14, I'm sorry, 15. Make sure you guys input that and you guys are doing those calculations in those charts. If anyone is confused on any of that stuff, reach out to me. I will go over it with you via Zoom, email, whatever it may be. I want to make sure you guys get the most points possible. Everybody seems to pretty much grasp the concepts of it, but sometimes it gets a little confusing. So just make sure you guys let me know. Okay, any questions on any of that stuff? No, okay. All right, lecture today is gonna be fairly short. Okay, so how we're gonna do, if you guys can see this goofy guy on the screen, we're gonna do a a short 10-minute video, basically reviewing blood pressure and its responses to exercise, okay? I know that I have told you guys about it. I know you've learned it in other classes. Sometimes it's easier to watch it on a screen, listen to somebody else, okay? So what our lab is going to entail this week, we are going to be measuring blood pressure, but we're kind of doing it in a different way. So for your lab this week, I'll go over it. I have given you guys the actual data that you are going to put in where you need to for blood pressure, and then you will finish the lab. Next week, we will actually practice going over blood pressure and how to take it, okay? I have attached this video as well as a blood pressure video to lab 4, so it's on there so you can watch them both again, but just know we are going to practice in person how to actually take blood pressure, okay? All right, we're gonna watch this video really quick. Bear with me, guys. It's about 10 minutes, and then we'll chit chat a little bit about it, go over your lab, and then you guys are free to go today, okay? Everyone can see the video? Yes? Okay, cool. Just making sure.
Hi everybody, Dr. Mike here. In this video, I want to talk to you about the role of exercise on the cardiovascular system, and more specifically focus on blood pressure, and talk about the fact that evidence is now coming out in the literature to highlight that certain modalities of exercise, more specifically exercise like high intensity interval training like CrossFit, tends to have the best effects in reducing blood pressure in hypertensive individuals. So the first thing I want to talk about is what blood pressure is. Blood pressure is the amount of force that the blood puts on the walls of your arteries. And if you go to the doctors, they'll put a cuff around your arm, they'll measure the pressure in your brachial artery, and they usually give you 2 values. These values usually are on average 120 over 80. And it's usually measured in something called millimeters of mercury, which I'll talk about that in just 1 second. Now, what this is representing is 120 is when your heart contracts. So here's the left-hand side of your heart. When that contracts to push blood out into your arteries, these arteries are going to stretch. Now, this stretch is the maximal stretch on the walls of the arteries from the contraction of the heart, and that's what we call systole. So the first value is known as the systolic value. It's the maximum pressure in your arterial system. The second value, the bottom value, is what we call the diastolic reading. And what that's telling us is when your heart relaxes. So when the heart relaxes, remember, there was a stretch in the arterial wall from systole. When the heart relaxes,
sorry.
the stretch recoils and snaps back to continue to push blood through. So that's the lowest pressure, and that's the diastolic reading. Now, why do we use millimeters of mercury? Simply because in the early studies, they connected our arteries up to a tube, which went to a little cylinder, and that cylinder had mercury in it, and they went to see how much that mercury was displaced when the heart contracted and relaxed, and it displaced 120 millimeters at the strongest contraction, systole, and 80 millimeters at diastole, or relaxation. So, but you could use water or anything like that. All right, now, because when the heart contracts, it's going to contract, relax, the blood pressure is going to go up and down, and then when the arterial system branches, the blood pressure is going to drop. It's really hard to know what the average pressure is, but we can calculate the average pressure, known as the mean arterial pressure, or the MAP. And the mean arterial pressure is easy to calculate. It is simply the diastolic pressure plus 1/3 of the systolic pressure minus the diastolic pressure. Sounds complex, but it's super easy. Diastolic pressure we know is 80 plus 1/3 of 120 minus 80, which is 40. So 1/3 of 40 is around about 13. 80 plus 13 is going to give us 93. So the average is 93 millimeters of mercury. That's the mean arterial pressure, 93 millimeters of mercury. So that means right here, 93 millimeters of mercury, the average pressure. Now, the other thing is this. The heart's going to contract and relax and push blood out. Now, every minute, the heart pumps out 5 liters of blood every minute. We actually call that the cardiac output. And as you can see, I've got the equation for blood pressure here. Cardiac output is one of them. I'll get to systemic vascular resistance in a sec. So 5 liters a minute coming out of the heart. Now, the Blood vessels, they branch and they're going to deliver. They're going to basically say, okay, the heart, you get this much of the 5 litres. The brain, you get this much. Gut, you get this much. How does it distribute it? Well, basically, the coronary vessels get around about 5% of that 5 litres. The brain gets around about 15%. The gut gets around about 25%. The kidneys get around about 20%. Muscles get around about 20%. And the skin gets around about 5%. That's how it distributes it. Now, we're talking about exercise. Muscles at rest get 20% of the 5 litres. So that means 1 litre per minute at rest of blood is going to your muscles at rest. What this ends up being is around about 3 mils of blood per minute per 100 grams of muscle tissue at rest. Now, let's just say you're about to do some exercise. You start to contract those muscles. When you contract the muscles, you start to use oxygen, you start to use energy, mainly in the form of glucose. So that means the demand for those things go up. Now, where do we get these things? We get them from the blood. So we now need to increase that 1 litre per minute up. We need to increase the 3 mils per minute per 100 grams. It needs to go up. How do we do it? There are little receptors at the muscle tissue that travel to the brain. Stimulate something called the sympathetic nervous system. Sympathetic nervous system, which is known as our fight and flight system. It gets activated in times of fear or stress to keep us alive in that moment. And so this gets stimulated in the brain and it sends neurons down, and these neurons are going to go to the blood vessels. And what they do is they tell certain blood vessels to constrict and certain blood vessels to dilate. This is what we call systemic vascular resistance. Think about it like this. If you've got a tube of a particular diameter, right? So that's the diameter of the tube. We've got blood going in. There's going to be a certain amount of resistance that blood's going to encounter because it's going to hit the walls of the vessel as it moves through. All right? Now, think about it like this. If I were to increase the diameter of that vessel, relax it, so now it's this big, there's less resistance, right? More blood can move through without being impeded by the walls of the vessel. So the resistance drops. If the resistance drops, drop resistance, it's an equation for blood pressure. If you drop one value, blood pressure is going to drop. If you constrict the blood vessel, make it really narrow, there's heaps of resistance. The blood backs up, and the resistance goes up. If the resistance goes up, blood pressure goes up. So what I'm saying is, constrict the blood vessel, blood pressure goes up. All right, keep that in mind. So what's happening here? Sympathetic nervous system innervates certain blood vessels to constrict. What it does is it tells the coronary arteries, tells them to dilate. We need more blood going to the heart, so it relaxes. The brain, it relaxes. The gut, it constricts. So we're stopping blood supply going to the gut. That's 25%. 25% of our cardiac output is no longer going to the gut anymore. The kidneys, it constricts a little bit. The muscles dilate significantly. The skin constricts significantly. So we've got mainly from the gut, from the skin, 30% of our blood being redirected now mainly to the muscle tissue. And this increases this 1 litre per minute to around about 20 litres per minute in intense exercise. 20 litres of blood per minute just going to our muscles. That in an athlete, times 50, times 25 to 50, so you can actually get 200 mils per minute per 100 grams of muscle tissue of blood going to that area. Now, what the sympathetic nervous system is doing, it's telling those that are dilating, like the muscle tissue, right? It's telling it to dilate, and it's doing this by increasing the amount of adrenaline, also known as epinephrine, noradrenaline, known as norepinephrine. It's increasing the amount of nitric oxide in blood vessels. This tells it to relax. Increases the amount of prostaglandins, which is another chemical that tells blood vessels to relax as well. Really important. And what happens is this. The sympathetic nervous system also goes to the heart, and it increases the contraction of the heart, increases the heart rate of the heart. So for some blood vessels, you get an increase in systemic vascular resistance, you get an increase in the heart rate, an increase in the contractility, which means more blood gets pumped out. increases that cardiac output, how much blood gets pumped out per minute, significantly increasing blood pressure. So during exercise, your blood pressure goes up. Your mean arterial pressure of 93 millimeters of mercury will go up and up and up and up. And in some cases, it can go up to 170 millimeters of mercury. That's the average. That is extremely high. Now, for people with hypertension, you're probably thinking, well, hypertension is if you've got chronically elevated blood pressure. So it's not at this at rest. It can be something above this. So it may be anywhere above 140 over 90, anywhere above that, hypertension, if taken over time. So how can stimulating this, increasing blood pressure during exercise, be beneficial for people with hypertension? Well, what happens is this. Once you finish exercise, you get a...
Okay, we're gonna stop there because we don't need to talk about how to fix the blood pressure right now. Okay, what are some of the main takeaways that you guys got from this? Does anyone have anything to add about it? We all gonna be super quiet today?
I would say like the concept of constricting the vessels and like the pressure and like deconstricting, I don't know, opening them up and then like the pressure decreases.
So dilating to open them up.
Yeah, dilating.
Constricting to close them. Okay. So yeah, that's a big point. So if we see, and sometimes it's, I know videos can be goofy, but it's good to have this all kind of spelled out for you guys. Okay. So obviously we talked about that systolic pressure being that max pressure exerted against those arteries as the left ventricle pumps, right? So obviously normal resting blood pressure, let's just take 120 over 80, like he said, just normal resting blood pressure. As we exercise, where do we have to bring blood flow, nutrients, and oxygen to? Anybody?
More to like the muscles and stuff like that. So
right.
as we're going through it.
Exactly. So if we're doing that, and we have to, obviously we need for muscle contraction, all those types of things, those are the working muscles of our body. Okay. So we need to get ATP there. We need to get oxygen there. We need to get all that stuff there. The only way that our body is able to do that is obviously increasing our blood pressure by our heart oh my God, I can't talk, beating quicker, okay, to get that cardiac output up, okay, and also by constricting certain blood vessels, okay. If we don't constrict certain blood vessels in our body, the blood will be flowing evenly throughout the body. Obviously, we just talked about those working muscles need that blood flow, correct? So this is why those blood vessels dilate, okay? So our sympathetic nervous system, if you guys can remember way back into anatomy, okay, is what controls this, okay? If our neurons are not firing correctly, we are not communicating body to mind, all that kind of stuff, we are not able to do this. What can you guys think of if somebody with, or what are some causes of high blood pressure? Can you guys remember some of them? Not diet or anything like that, but what happens to the arteries in the heart that could cause blood pressure, high blood pressure?
I mean, there could be like a blockage or something like that, like within the arteries,
right?
Which will cause for somebody to have to get stents within surgery to allow the blood flow to go through better.
Exactly. So blockages are one, or even the hardening of artery walls. So like atherosclerosis, that's the hardening of your arteries. So if we think about this and we have somebody that has high blood pressure already, okay, if you have blockages in your heart or the artery walls constrict, it's going to be tougher to pump out that blood. The blood pressure is going to rise. So now if we have a patient already with higher blood pressure, okay, and then we add resistance training or any sort of exercise, you can see naturally how that blood pressure will rise, okay? Now there's a lot of contraindicating research out there saying that yes, you have to put those types of patients through exercises that will higher blood pressure, okay? So it'll help the sympathetic nervous system to dilate and constrict your blood vessels, okay? But we're not going to talk too much about that, okay? I just wanted to show you guys this video so you kind of understand how blood pressure works, what has to rise in the body, okay? So like your blood or your heart rate, your cardiac output, your stroke volume, okay? We should all remember what those are. All those things increase as we start to exercise, okay? And it also will increase in different types of body positions, whether we're sitting, we're laying, we're standing, all those sorts of things, okay? Do you guys have any specific questions on blood pressure per se from this video? Okay, this is a good thing for you guys to reference if you do get a little bit confused. Like I said, sometimes it's good to see a visual. So go back to this if you need to. I'll obviously post this, but this is also on your lab. Okay, let me switch my screen share and we will go over the lab really quick. I have 1,000,001 things open, so I got to find it first. Here it is. Hold on, gotta find it. Okay, you guys can all see this? Okay, so when we were on lecture a few weeks ago, or last week sometime, remember we talked about how different body positions will obviously cause differences in our blood pressure. Okay, so let's review those really, really quick before we go into this lab, and then I'll describe it and you guys will be good to go for today. What is the body position, okay, that you would be in that you would probably have the lowest blood pressure? Can anybody remember?
I thought it was either sitting or the subspine position. I think it was
Supine.
sitting. Supine. Okay.
Supine. So if you are lying down flat, does anybody, can you guys think of why?
I think it's because like how the blood's like traveling like through the body compared to like sitting.
Yep.
It's probably more of like a rush of a flow compared to where you're laying kind of flat. So it's kind of just like not, I don't know, it's not flowing as well probably as you would be sitting or standing through the
Right.
body.
So if you guys think about it, that's absolutely right. So if you are laying down, remember we have these valves in our veins that help push the blood back to our heart. When you are sitting, or I'm sorry, when you are laying, they are not fighting gravity, okay? When you sit down, stand up, or anything else, the valves in your veins are going to be fighting gravity, okay? Same with when your heart is pumping, okay? It's going to have to pump harder against that gravity to get the blood out, okay? When you are lying down, your heart rate is also lower. It's relaxed. It's easier for it to pump out, okay? And then refill back with blood, okay? So technically, your lowest blood pressure should be when you are supine at rest, okay? Let's talk about other ones. So obviously, if we sat up, what do we think would happen?
The blood vessels would fight against the gravity then, allowing the blood to go out and go faster throughout the body.
Basically, so your blood pressure is going to go up. Your heart is going to have to pump a little bit harder to get blood out to the rest of your body. So there should be a general small rise in blood pressure. Do we remember which number would go up, systolic or diastolic?
Isn't it systolic?
Systolic. Yep. So your systolic number will go up. Obviously, that's at max pressure against your arteries. Okay. So that is what's going to rise. Okay. So if we go from a seated position to a standing position, okay, this one's a little bit different. That initial standing position, do you remember what would happen to your blood pressure? It might not be what you think. Anybody wants to wager a guess?
Doesn't it drop because the blood like rushes down?
Exactly. So that you're sitting down, that initial standing, your blood pressure will drastically drop, okay? Just because of that change in gravity, okay? And the blood is now rushing from your head, everything down to the ground, okay? So your blood pressure is going to drop. As you continue to stand there, say for a given 3 minutes to however long, your blood pressure will slowly go back up, okay? And your blood pressure standing is obviously should be a little bit higher than sitting, okay? So everybody with me so far on how that happens, okay? All right, What other things? Okay, do we remember what would happen if we threw in isometric exercise? So that exercise where we're really contracting our muscles, not moving. Anybody?
I mean, your blood flow should realistically go up as you're doing any type of workout. So I mean, if you're not, you're really not doing much. But
So yeah, so obviously if you're, let's just take a plank for example, okay? Because everybody knows what a plank is. If we were doing a plank, even for 30 seconds, but even technically they say after 20 seconds, there will be a dramatic rise in blood pressure, okay? You are putting a lot of pressure in your body for the blood to go to those working muscles. Obviously, we also talked about in lecture, so you guys can review this as well. It's up on one of the recorded lectures, that if you are doing isometric exercise, sometimes that occludes the blood to the muscles. That means it stops the blood flow to the muscles. So your heart is going to continue to pump to try to get them there. So obviously your nervous system tries to overcome this. Your blood vessels will dilate there. So you try to bring more blood flow. But what I want you guys to grasp is that during isometric exercises, your blood pressure will dramatically rise. Do you guys think let's just take two different types of exercises. So if I am holding, or if I'm doing it like with 5-pound weights, okay, and I'm just doing an isometric arm curl. So I'm just holding a bicep curl, okay, so that's one of my exercises, or I'm doing a wall sit against the wall. Which exercise do you think would cause your blood pressure to rise the most? The wall sit or the bicep curl?
I'd probably say the wall sit.
Wall sit.
Yep, I heard wall sit a couple times. You guys are right. Think about it. That is a much more extensive exercise. First of all, you're holding up your body weight, okay? You're also using larger muscle groups. If I'm using these larger muscle groups, I'm using my quads, my glutes, and also eccentrically my hamstrings, okay? So I need to bring as much blood flow there as possible, as opposed to just doing an isometric bicep curl. It's still going to raise your heart rate, or I'm sorry, your blood pressure, but it's not going, realistically, it shouldn't raise your blood pressure as much as a wall set, okay? So this is how I want you guys to think on this lab, okay? I, obviously, like I said, in the lab, I placed the info that you will have to turn in, okay? So let's go over this really, really quickly. Okay, I gave you a subject. I wrote their height, their weight, whether they're male or female, okay? So this is what you're obviously going to put your name, your date. Everyone can see this screen, correct? Just before I start talking about it. Yeah, okay.
Is this
All right.
for Monday? Okay.
I'm sorry, go ahead.
Is this one going to be for Monday? Like, is this the short assignment?
No, this is not going to be due Monday. You guys are going to have a little bit more time. I believe it's due the 14th, but I will double check and send you guys an announcement on that, okay?
Okay. All right.
All right, so then you're going to put the subject, just put one. The subject doesn't have a name. Fill this all out. I did not put the information for height and weight in SI units, so you guys need to calculate those and put them in SI units, okay? I did give you all of this information. It is in a chart, okay? And you will obviously fill it in, okay? It's very self-explanatory. You will do the same for this chart down here and the same for this chart down here. So this part of your lab, super simple, okay? Don't worry about the weight for the bicep curl or the wall sit. I don't care about that right now. I just want you guys to be looking at the blood pressure, okay? We're also not going to be worrying about the heart rate because we are obviously not there doing this lab. I'm just worried about you guys getting the blood pressure part of it down. We will obviously break it all down once we are in lab together, okay? So you filled this all out. All right, and you are gonna go down here. So let's go over the questions. I'll give you a little bit of tidbits on what you guys look for. So what changes did you observe in heart rate and blood pressure in the 3 positions? What I want you guys to remember, if your blood pressure is going up, what is happening to your heart rate? Anybody?
Your heart rate's going up.
Your heart rate's going up. So remember that for this portion of it, even though we didn't write down the heart rate, okay? And then you're gonna have to talk about what accounts for these changes. So think about the video that we obviously just talked about or just watched. Review that, and then you guys can obviously review your lecture, okay? Certain things when you go from sitting to standing or when you're lying down, think about what we just talked about. Think about gravity, think about the veins, think about what would cause a rise in blood pressure and heart rate in certain positions, okay? So if we go down to number 2, it says, what is happening physiologically when a person stands up quickly and gets lightheaded? Okay, we answered that question already today, so I'm not going to repeat it. Okay, but there is a slide on your lecture for blood pressure. So if you need to review, it is in there. Okay, don't just put an answer down because you don't know it. Okay, think about it. You guys can get this one. The answer's in there, and we talked about it in lecture today. Okay. How does isometric exercise affect systolic blood pressure and diastolic blood pressure? Why and how does light cardio exercise affect systolic blood pressure and diastolic blood pressure immediately and after 1 minute of exercise? Okay, pretty self-explanatory. Look at the numbers that you guys see, okay? But also think about what we have talked about. Think about what the body is going through, okay? Think about why, if your systolic blood pressure is going up or your diastolic blood pressure is going up or down. That diastolic number is going to change a lot less than that systolic number. Okay, remember that, but there is one little instance where maybe the diastolic would drop a little bit. Do any of you remember what that is? If you guys don't, I'll just tell you. Sorry if someone was just about to say something, but diastolic blood pressure might drop by like 10 in aerobic activity. Okay, that's probably the only time that you're going to see that. If you have a drastic drop of 20 or lower, or even a rise in it, then you know that you have an issue and you need to immediately cease exercise. Okay, 2 more questions. Okay. How does blood pressure response during an arm exercise compare to a response during a leg exercise? I just talked about this, so you guys should be good to go on that. What does this lab illustrate about exercise prescription in hypertensive clients? Okay, we also kind of touched on that. Think about in hypertensive clients, they have high blood pressure. Think about why they might have high blood pressure, okay? Yes, obviously it can be things like your diet or being sedentary, but think about what happens to those arteries, okay? If we need our arteries to dilate certain areas, constrict in other areas, think about why for a hypertensive client that this might be either good or bad, okay? This might be a little bit more difficult, but just think about it as much as you guys can. I'm not going to score this bottom one as hard as the other ones, but I want to see what you guys come up with without me giving you guys the answers. Don't be afraid to use Google or look at other things as well. You don't just have to rely on what I say, okay? Look at your PowerPoints, all those types of things. If you are looking online, and you are looking at something like YouTube, make sure it's a reputable source, okay? Don't just go to some Joe Blow who's saying whatever. You know, obviously that last lecture we looked at, it's from a doctor, okay? Make sure you're looking at that source, but a lot of the times it's really good for you guys to research on the internet as well and look at other sources, okay? Are there any questions on this actual lab? Okay, if you get to this and you are confused how to input numbers, anything along those lines, just reach out to me. I realize that actually being on Zoom doing this is a lot more difficult than actually being in class and me being able to come up to each and every one of you if you have a question and show you, okay? Sometimes if I'm on Zoom, maybe I don't describe things the way that you understand. It's okay. I will not take offense if you say, hey, Coach K, I have no idea what you just said, okay? I'd rather try to talk you guys through it to get the point across. Okay, so we are good on this, correct? Okay, this is due October 14th, I believe, which is next Wednesday. If we come to it and we are struggling and we need another day, we can take another day. Okay, but you guys need to reach out to me and let me know if you guys are having issues. Okay, so let's review before I let you guys go. Okay, lab 15 is due this Sunday, okay, by end of day. Try to start getting it done now. If you have questions, ask me now, okay? Just so you guys aren't struggling to get this done over the weekend. You guys are doing really good in this course. Let's keep it up. Let's not drop the ball, okay? Then obviously this lab is due October 14th, okay? So then looking at the schedule for next week, and I will also send out a reminder on Fridays like I always do, but Monday will be a recorded lecture. I know we normally do live, but we will have a recorded lecture. It'll be up by class time. If I have it done earlier, I will just get it up earlier and let you guys know so you can begin it earlier, okay? There will be a very small assignment that just goes with that to make sure that you guys have actually looked at the lecture so I can give you attendance for the day, okay? Wednesday next week, we will be in class, okay? We will be going over a lab for resting metabolic rate, and then we will also be practicing taking our blood pressure, okay? I know we haven't done that yet. I know we didn't have time now. I just want to make sure we are understanding how to do it. It is important if you guys ever get into any sort of field in the fitness field or any type of clinical field that you understand how to take your blood pressure. It's not that difficult, but it takes practice, okay? Sometimes it's hard to hear the pulse through the brachial artery. You have to know how to put the blood pressure cuff on. I don't want to do it over Zoom. It's going to get way too confusing. So we'll actually do it in class. Okay? Any questions at all? Didn't think so. Okay, I will stick around for a minute if anyone has a question. Otherwise, you guys can pop off and then let me know if you have any questions moving forward, and I will see you guys later. Have a great weekend.